Important. If you are currently in crisis, please call or text the Suicide Crisis Line at 988 or go to your local hospital. The following presentation is meant to support the mental well-being of nurses, but in no way replaces the need for medical professionals or any prescribed treatments you may require. Admitting to needing help is the first step. Having the insight to seek out medical attention and recognizing the need for help in coping shows your unwavering strength and dedication. It is okay to not be okay. Welcome to the WeRPN Practice Resources, Self-Care for Nurses, Mental Well-Being, Part 2, Mindfulness, developed by WeRPN with the support of the Government of Ontario. This module will focus on mindfulness in understanding mindfulness versus mindlessness, why we should be mindful, mindfulness and healthcare providers, in addition to working on mindfulness in understanding types of mindfulness programs, practicing mindfulness, and mindful meditation practice. Mindfulness versus mindlessness. Mindfulness is basically learning to pay attention, moment by moment, intentionally, and with curiosity and compassion. Groves, 2016. And having awareness without judgment. It originates from the Pali word sati, Davis and Hayes, 2011. Mindlessness occurs when our mind creates judgments that act as a barrier separating one from their own life. When experiencing mindlessness, one can redirect themselves by participating in meditation to be able to cultivate mindfulness again. This allows the mind to be able to be conducive to happiness with oneself and others. Muse, 2011. Mindfulness is important. There are several benefits to being mindful, and these benefits can include improved well-being. When one is mindful, it is believed to promote well-being within one's life. It does so by disengaging individuals from unhealthy behaviors or habits. Brown and Ryan, 2003. In addition, according to the American Psychological Association, to disengaging individuals from unhealthy behaviors, mindfulness can reduce stress, improve memory, increase one's focus, decrease emotional reactivity, and bring satisfaction to one's personal relationships. Mindfulness and healthcare providers. According to various studies, it was found that 66% of new graduate nurses experienced severe burnout. 14% of nurses reported having PTSD. Focusing on healthcare providers specifically, mindfulness can also improve burnout, improve depression, and improve anxiety. As the statistics show, there is a portion of nurses struggling with burnout, depression, and post-traumatic stress disorder. Mindfulness can help healthcare providers address these negative outcomes in addition to helping individuals with decision making and job performance. Gilmartin et al., 2017. There are many forms of mindfulness programs, from formal facilitated programs to self-care activities. These formal programs include MSBR, which is an 8-week program created at the University of Massachusetts Medical School and was created to help individuals manage stress. This program was also used to help individuals with other conditions such as chronic pain, high blood pressure, and job or family stress. MBCT is a program that was created to assist individuals in staying well. Psychologists created this program by combining 3 areas: cognitive therapy methods, mindfulness, and mindfulness meditation. By participating in this type of program, individuals work towards learning how to focus on both accepting and observing one's own thoughts without reacting or judging them. More specifically, this type of program is helpful for those with conditions such as depression, anxiety, and addictions. MBRP was created to assist individuals in being able to avoid a possible relapse to a form of addictive behaviors. An example of an addictive behavior this program could help avoid a relapse in is those with substance abuse. Furthermore, it was also then adapted and made to assist those with a gambling problem. Practicing mindfulness. There are various areas one can develop mindfulness. You do not need to commit to a formal program. Mindful meditation has been found to be one of the greatest effective focus among research. Meditation is known as a self regulated practice where an individual trains their attention and awareness in a way to nurture one's mental well being. Davis and Hayes, 2012. It is both a physical and mental exercise to greaten one's ability to be in a state of moment by moment awareness. Muse, 2011. Mindfulness can also be practiced in an everyday routine or schedules. It can be fit in by being present in the moment. Pay attention to your present situation without any judgment. Let judgment pass. When you feel yourself begin to judge, note the judgment mentality and let it pass. Be kind to your mind. Avoid judging yourself and your own mental thoughts. Getting started with mindfulness, 2019. We are now going to practice a meditation exercise. Begin by sitting with your back against a straight back chair or with your legs crossed on the floor. Next, focus on an area of your breathing. This can include either the air flowing in your nostrils and out your mouth, your abdomen rising as you inhale and falling as you exhale. After you have narrowed down an area to focus on, begin to become aware of other aspects, such as any sounds around you, sensations, and any ideas you may have. Finally, with each thought or sensation, begin to embrace it without judging it as positive or negative. If you notice your mind beginning to race, bring back your focus to your breathing and attempt to re-expand your awareness again. How did you feel? Were you able to completely focus? This may take time, and it is common for your mind to wander when you first start this practice.